Hello, good afternoon, good morning, good evening, wherever you're tuning in from, ladies and gentlemen. Welcome to this presentation by Veronica Fortu. I'm a DMP student at the Brown University with a major in mental health and psych NP. And today I will be presenting to you a stakeholder education plan. And to start with, I'm going to introduce to you essential two of the eight DMP essentials: organizational and system leadership for quality improvement and system thinking. The reason why I introduced this is because organizational and system leadership are critical for DMP graduates to improve patient and healthcare outcomes, as doctoral level knowledge and skills in these areas are consistent with nursing and healthcare goals to eliminate health disparity and to promote patient safety and excellence in practice. According to the ANNC in 2006, DMP prepared scholars are also skilled in working within organization and policy arenas. And this is the place where the stakeholders are important in this project. Throughout my years as working as home health nurse and recently in the last 6 years as a hospice nurse, I came across patients, especially cancer patients at end of life whose major problems were inadequate control of their cancer pain. And a lot of patients end up passing in pain, which defeats the goal of holistic care and hospice care as a whole. And so I begin to think and question myself what other measures that could be put in place to um, into better outcomes and pain outcomes. And we see the interventions put in place before titrating narcotics and pain medications and sedating patients and patients having constipation as a result of opioids. And families are not very happy. And I've seen a lot of families that have deviated more um, in incorporating complementary alternative medicine and shying away and moving away from the use of opioids in patient comfort. And this is where this project comes in place. The addition of Reiki therapy to conventional medicine in improving pain outcomes for patients, cancer patients with pain at end of life. And the stakeholders that will be presented here and very important in this project, policymakers, a representative of the U.S. Congress, providers such as the CDC, NIH, W Health Organization, and providers, um, Kaiser Permanente, a lead doctor in the Washington area, Dr. Alison Lewis. She leads a team of other doctors that oversee as many as millions of patients in 7 different regions in the country. And so, as you see, Kaiser Permanente is providing care and is also an insurance provider to as million as many other people. That's the reason why their input in this project is very important. They're serving a whole lot of hospice patients, and especially in the Washington area, in the California area as well. And the input will be as important. And the CEO of the company, the payers, Kaiser Permanente serve also as a payer because they serve in insurance dynamics patients in 7 areas, regions in this area. And talking about CMS, Center for Medicare and Medicaid services that also serve in nationwide. And the stakeholders important um, because they will be overseen and they will oversee the policies that will be put in place and see how they can meet patients in coverage in covering this new project as we move along and see what has been done before, the intervention put in place to um, overcome pain for patients, cancer patients at end of life, the use of narcotics, the use of other methods as chiropractic and other methods have proven to be less effective. The reason why we still hear a lot of patients complaining and families frustrated because the outcomes have not really yielded so much interest profit in place. So the educational theory and conceptual framework. Theoretically, Kathleen Kokaba's theory of comfort has played a very important role in shaping my personal philosophy of leadership and innovation. Kokaba's theory places comfort once more in the forefront of healthcare by outlining the role comfort plays in the lives of mankind as a whole. This theory has been the driving force behind my leadership goals as DMP preferred scholar and leader. The theory has helped me identify the problem of my project, how to improve comfort for cancer patients at end of life by improving pain management outcomes. And according to the comfort model, comfort is an immediate desirable outcome for nursing care. This takes me to a presentation that I watched presented by Michael Porter. And he presented this presentation on YouTube in 2011, where he made very interesting case concerning the value-based healthcare. According to him, one of the issues with healthcare is getting access, and patients don't get access to healthcare because of limited coverage. And so the real problem and the goal of healthcare is value, the delivery of good, valuable patient outcome per dollar spent. He reports that administrative cost drives cost in the delivery process. And so the spending time in the process and the patient is not really getting the care that is needed. So the combined use of Reiki therapy and conventional medicine puts into motion a plan for the process, activities, the relationship that the system has to implement for desired outcome by to be achieved. What then is changing in the environment that we need to know and need to consider? The increased use and the demand for complementary alternative medicine with the increasing popularity of CAM providers orientation toward health promotion and prevention, and the growing body of research demonstrating the cost effectiveness of CAM. Policymakers and insurance invested in addressing the rising cost of healthcare should work to ensure that implementation of the Affordable Care Act proceed as intended, which is not always the case. This is where the stakeholders come in, the policymaker, to affect healthcare policies to accommodate budget allocated for more research, the provider to facilitate staff training and ensure patients have a choice to have the tools to pursue the choice, the payer to ensure stakeholder ensure coverage for quality healthcare consumption. And then what determines cost is how unhealthy the patient is. The more a better way to cut costs is getting patients healthy. Increased pain outcomes means decreased cost and happy patient and family. So according to the Harvard professor Michael Porter, healthcare reform is proving to be one of the defining issues of the 21st century, both in the United States and throughout the world. Costs are exploding even in single payer system driven by aging populations and rising expectations for better care. There's held heated debate about what to do, but they focus on the wrong question: how to cut costs. Porter contends that the only real solution is to transform the delivery of health care to dramatically improve value and the health outcomes per dollar spent. Healthcare system in every country, they will have a value problem, and fixing it will require reconstruction of care delivery itself into incremental solutions. How will this plan be implemented? We see the estimated in a study, the estimated total yearly cost of pain in the United States range between 560 to 635 billion, and the total incremental cost of healthcare due to pain range from 261 to 300 billion, and the value for lost productivity range from 299 to 334 billion. This is a huge loss in terms of dollar amount, necessitating a solution. There is therefore an urgent call for further new research and more changes in the healthcare system to effectively manage pain and cancer pain and the way pain is treated assessed and understood. Cost benefit analysis for adding Reiki therapy to conventional medicine indicates that improve outcomes with decreased costs in that Reiki master annual salary is way less than the salary of a hospice doctor. Mileage for traveling for patients home is only a 7,200 per year. Cost of training a nurse or Reiki master is also less, 1,600 per rescheduled data, customer service. And so when we add all of this, benefit for 10 patients at the price of 90 for 120 days is 108,000. Retention rate for hospice is 120 days. Thus, the added use of Reiki to conventional medicine to improve pain outcomes for cancer patients at end of life proves to be profitable and save more revenue for the patient and healthcare industry. Although Reiki is currently only covered by health insurance when it is part of a treatment such as physical therapy, massage, and palliative care, or when it is delivered by a nurse or licensed care professional as part of routine care, many families are ready to cover out of pocket costs because of the benefits and less side effects from face to face interviews with patients and families. This research, the researcher hopes to see research evidence become action in the form of a new policy, program, or decision because not always are these hopes realized. The successful completion of this project will require collaboration from every stakeholder. This project will produce a lot of information, and thus this project manager will not want to overburden or drown you in so much information, but we want to give you enough valuable information so that you're informed and can make appropriate decisions. That said, it is also important to note that changes may need to be made to the plan as the project moves forward. Here is a general framework. The plan proposal for this defines the general communication requirements for your project. The communication goals. We will be communicating via internet, conference calls, face to face, and this will involve every stakeholder, a representative from Kaiser, CMS, and patient on acceptance of the project. Communication tools and methods. The meetings, status report, newsletters, formal presentations, surveys, internet, intranet, web page, informal small group meetings. There's a small table that is also attached to this project as to the project delivery plan, and it will be updated as the project progresses. And also, I have a reference page as to where this information was taken from. If you have any questions, you can always email me. We can have our face-to-face, internet, Skype, business, and we'll be addressing concerns as we move forward in this project. Thank you for watching.